kids learn from their parents. So what types of things are your parents showing you and
Mm,
introducing you to, and really being that model for them? And sometimes that's really hard. Sometimes that model is there and kids aren't interested necessarily, but sometimes that model doesn't even exist for the parents. They're not really sure how they manage themselves or their self-care.
Making the healthier choice usually means getting outside of your comfort zone. It
There you
usually
go.
means
Yeah.
encouraging, doing the hard thing, right? There is this kind of idea, I feel like, in our society as well, where we want to get to a point where we retire and can be on that beach with the drink, with the
Yeah.
umbrella and all that stuff. And that's all well and good, but if you talk to a lot of those people, they were more fulfilled and happier when they were working hard, when they were grinding, when they had fulfillment. And, that just speaks to, the state that human beings like to be in.
Welcome to the CoachMD podcast. I'm Dr. Charles Glassman, bringing you 3 decades of experience as a physician and a coach. Join us as we navigate the maze of medical advice with real-life stories, empowering you to take charge of your health. In our That Happens segment, guests share transformative experiences, reminding us that we're all human and not just patients. So get ready for a journey into healthcare reimagined, where empowerment and discovery pave the way. Hey, it's Dr. Charles, aka CoachMD. I'm over 30 years of medical practice. I made it my goal to help my patients create a strong mind, a healthy body, and an unshakable spirit. And that's why I started the CoachMD podcast, because there's so much talk out there about medicine and relationships with doctors. But I've had so much experience over the years. I wanted to share my experience and have guests come on who have experiences themselves with their ideas of their own health, how they manage their health. And it's my experience over those years of practice that there's really only 2 things mainly that bring people to a doctor's office. And unfortunately, doctors are ill-equipped, many of them, to deal with those things. And those 2 main categories are mental health, behavioral health, and lifestyle choices. So the people who are struggling with emotional issues, and you don't have to be crazy, okay? You don't have to be certifiable where you really have a psychiatric diagnosis. Just the challenges of everyday life are enough to make people uh, have the emotions all over the place. And those emotional instabilities, a lot of the time, or emotional challenges, a lot of time, show themselves in physical ailments. And then there's, of course, lifestyle choices that we make that cause illness. And so my guests today are Steve Neer and Jess Colucci, and I know them through my lifestyle choice of physical fitness. That's how we met. But they have a great perspective on this because they're really making it their career to address the emotional part of our lives and also lifestyle choices, the physical things that we can do, actually do to help ourselves and to stay well. Because when we go to the doctor, most of the time, let's face it, it's sick care rather than well care. So it's a sick care industry, and so many medications and things uh, kind of fall into that and feed it. So I'm going to just ask you, Steve, to give me just a little glimpse of what you're doing, kind of in that area of addressing emotional well-being and lifestyle choices.
Yeah, absolutely. Thanks for having us on. So as a mental health counselor, I really do get that opportunity to meet with a lot of people and kind of see and get a glimpse into what's going on with them emotionally. And you're absolutely right in terms of what you started off with today, talking about how what are the things that bring people in, and how they what brings them to a doctor or some type of practitioner to deal with what's going on. So, ultimately for me, I really just get to hear a lot about of what are the obstacles that get in people's way, whether that be mental, physical.
Mm,
Sometimes they create some structures in their mind that tell them that they can't do something, or that make them afraid to try something because of the possible consequences. So, I feel like in a lot of ways, I really just address it by finding out what those obstacles are, hearing what it is that people are dealing with, and finding a way to make them look at it a little bit more realistically.
Yeah, I love that. Now, Jess and Steve are married, okay? Married couple, a true, I look at them as a true power couple. And if you know anything about CrossFit and the workouts that CrossFit entails that we do, not I don't do it to the level of these guys, but it doesn't matter. Everybody's in their own lane, but they are truly a power couple. But Jess, you're working also in the Lucan Center as a therapist. And what are some of the challenges that you see in this aspect with people who are coming? I know you deal with also pediatrics and children. What are the things that you're seeing in that area where emotional well-being or lack of well-being and the lifestyle choices, perhaps of parents or the children that are contributing to kind of their overall wellness and health?
Yeah, absolutely. So one of the biggest things that I always talk about with the families that I work with, if I'm thinking more from a pediatric level, is that kids learn from their parents pretty much for the most part. They're exhibiting they're getting introduced to their world through the lens of their parents. So what types of things are your parents showing you and
Mm,
introducing you to, and really being that model for them? And sometimes that's really hard. Sometimes that model is there and kids aren't interested necessarily, but sometimes that model doesn't even exist for the parents. They're not really sure how they manage themselves or their self-care, and or they aren't really sure how they regulate their emotions, and that goes a really long way when kids are struggling on their end as well. So a lot of times when parents are asking me how come they're not practicing their skills or how come they're not doing X, Y, or
mm.
Z, I'm usually reflecting it back on the parents. I'm asking them, well, what are you doing in the moment? How are you contributing? And what can you do for yourself before you're going to help your child to get through a rough emotion? We always use the analogy when you're on an airplane and say you put your oxygen mask on first before you help anybody else. So in that moment, are you kind of ramping up your emotions and then they're
Yeah.
feeding off of that, or vice versa? So it's always a lens to kind of go in on with the parents on that.
Yeah, it's so major, because yeah, I was a internist for all this time, over 30 years, and when I started my writing, I had to do a lot of introspection because I have to walk the walk if I'm going to talk the talk. So when I was started my emails and sending out my kind of motivational emails to my patients, I had to look into myself and figure out, kind of what would derail me, what would get me on a course that I didn't like or that would stress me out or give me anxiety. And so one of the things that when I was going through this, I came up with the concept of automatic brain or automatic nature or animal nature and our divine nature, which is our higher consciousness, which is the thing that can really help us. But so often we run on this animalistic instinct, and a lot of people look at it as reptilian, the fight or flight. And that's basically what it is, because that automatic animal brain just reacts to danger, threat, and vulnerability with two things, fight or flight. And some people say freeze, but that's really when you fight or flight at the same time, and it paralyzes you. But the reason why I'm bringing that up in this instance with the parents, because so often the models are our parents, and the culture of the household is so important, because that's really where the love is. And one of the big dangers that I look at from that trigger this fight or flight is as our animal nature will fight and flee anything that threatens love. So if the structure in the family is one of, I use the example of a patient who came to me once, and she said that her family, and she was obese and wanted to lose weight, but she told me that when she was growing up, her family would make fun of the skinny relatives, right? They would call them the vegetable or the carrot people, right? So the model of her household was such that if she started to lose weight or get more fit, that would threaten the love of her parents. And so this carried on to her adult life and the lifestyle choices that she makes. And I think I want to dive in a little more deeply this, because you have so much experience, Jess, with the pediatrics, and this kind of concept that I have is more of a theoretical, and how I see it exhibit itself in adulthood and the adults that I treat. But how do you see that? Am I onto something when I talk about that? With the way that dynamic is set up.
Yeah, you're absolutely onto it and nailing it. And it's really interesting because the way that our family dynamics work, we grow up and we're raised in, we're raised in a certain network, and we really understand the world around us based off of the relationships that we have with our close family members. And then we go and we replicate those relationships pretty much outside of the family unit itself. And if we're holding all of these internal thoughts about ourselves for such a long time based off of how we're interacting with our family members, we're going to go and take that until somebody might say, hey, actually, I don't know if that's really a helpful thought. Where did this come from? And when you start to explore it, that's typically when we start to recognize that maybe there might have been some dysfunction happening in the family unit. And it's really hard too sometimes as an individual to make that change in a family, because the dynamics are so strong that our family is stabilized by everybody playing a role. So when you play
Yeah.
that role in your family, when you're trying to break against it, you're trying to make change for yourself, everybody wants to hold you into that role that's just
Mm,
comfortable for
yeah.
everyone. So the more that you try to break out, the more that there might be some backlash or pushback. It might take a little bit for you to kind of work out that dysfunction that you're recognizing as an individual and off in the world. So yeah, I mean, you're definitely on the right track with that.
Yeah,
Absolutely.
and you mentioned about the comfort, and we all have that when we fall into that comfort zone, and that comfort zone a lot of times is really uncomfortable and unhealthy. But and that's why it's important to because a lot of people will use the excuse as adults, oh, I grew up this way, this is what I know, this is the only thing I know.
Mhm.
But you can really change things. And now in science, we recognize epigenetics. So you could actually change which genes are turned on and turned off, and actually change your legacy. Your legacy can be much different. And so, I look at that, with mindset and how that affects our overall wellness and satisfaction. And I know both of you are working in that area in mindset, especially with athletes. But a lot of people they say, oh, I don't, I'm not an athlete, so that doesn't apply to me. But you don't have to be an athlete to apply mindset in the way you live your life. And so when we make choices in our life, lifestyle choices, it's going to take a very strong mindset and looking at things differently. And so, Steve, if you could tell me a little bit about how you approach that, both as an athlete, and for my listeners, Steve, this is Steve Neer. Okay, Steve Neer was very close to going on to the finals in the CrossFit Games. Okay, and the CrossFit Games finals are that's what determines the fittest person on earth, male and female. Okay, the fittest person on earth goes through whoever wins the CrossFit Games has that title, and it is truly it's accurate. It's not hyperbole. It's accurate. And Steve was in the semifinals in Canada, and it's brutal competition. And so he knows something about competing at a high level as an athlete. But I know that not all your clients, and I'm sure maybe some of them are high level athletes, but you have regular, just regular people, and so how could they use some of the things that you teach to make the better choices and have a really healthy, well, satisfying life?
Yeah. Yeah. First off, I appreciate the gap of my level of fitness. Always feels good to hear.
Yeah.
But you were saying that, not everyone has to be an athlete, right? Like you do have to do athletic things, but you don't have to be an athlete. And honestly, what I say is you don't have to be an athlete, but you'll be a lot healthier if you try to be one.
Like
And
that.
accepting that mindset, I mean, if you look at honestly what health looks like, athletes are the ones that have the least amount of metabolic syndrome. They have, the least amount of all of these really plaguing physical illnesses. Once you get to a very extreme level of athleticism, or expressing yourself as an athlete, we can
Yeah.
talk about some of the stress and the mental health issues that can come in with that. However, it teaches you so many lessons about, overcoming obstacles, over, not getting something the first time, not giving up, and then the reward that comes with being able to overcome that. Through my endeavors, I've ultimately, with CrossFit, been able to, take on things where I've literally tried a skill, looked like an absolute fool, not been able to accomplish it whatsoever, but, went back to the drawing board, figured out a progression, and eventually did it, and did it very efficiently.
Mm.
And, just little things like that can really teach you a lot about life, a lot about, raising your self-esteem, right? How to work with people too. There's some teams that compete in CrossFit as well. So there's the communication aspect. So, ultimately, I feel like that has been a great sort of microcosm as to, different ways of having a growth mindset for life. And I really think that growth mindset is where you lead people to being healthier, because making the healthier choice usually means getting outside of your comfort zone. It
There you
usually
go.
means
Yeah.
encouraging, doing the hard thing, right? And, there is this kind of idea, I feel like, in our society as well, where we want to get to a point where we retire and can be on that beach with the drink, with the
Yeah.
umbrella and all that stuff. And, that's all well and good. But if you, talk to a lot of those people, they were more fulfilled and happier when they were working hard, when they were grinding, when they had fulfillment. And, that just speaks to, the state that human beings like to be in. And that's to have struggle, to, to grow, to learn, right? So
Yeah.
when you stop doing that, that's really what leads to a lot of decline physically and mentally. So, really we don't age because we're aging. We age because we choose to stop doing the things that we used to be able to do, or we're doing, that were keeping us healthy and keeping us young. So sort of
Yeah.
that education piece, um, and honestly drawing on clients' experiences of, times that they were able to work through something or get better at something, and kind of use that as the backbone for, like, hey, look, like that's what we want more of. That's what we want to encourage more of in your life, to bring that health and happiness.
Yeah. Yeah. I love that. It's one of the things that I see is so limiting, and it limits that growth, is how we label ourselves. And as a doctor, I saw it all the time. When somebody will come in and they'll introduce themselves. Oh, I'm so and so. I'm a diabetic. I
Mhm.
am a diabetic. They own that. Okay.
Yep.
Or they'll say, "Oh, I have a bad back," and so they've addressed that, they've labeled it, and that one of the things I really love about CrossFit, and it's kind of an advertisement for CrossFit, which I don't care, because it's really a great anybody who's who is close to a CrossFit gym, I think probably should go and seek out the trainers and get training first. Don't just go into it, get the training and learn the skills, because you're an athlete. They look at you as an athlete. You could be label yourself, oh, I am the most unathletic person. I'm so uncoordinated. And that's something you've carried on throughout your whole life. But we know how great we feel after we work out, right? I mean, it's just, and as we get older, that it's the most important thing to ward off so many different ailments, especially dementia, is exercise, not doing crossword puzzles or whatever. People think, that's the way to do it. It's really physical fitness. So, but I like to draw upon, people who were athletes and who had full plates, and who were able to kind of navigate their life despite having a full plate, And, and because people look at me sometimes, especially when I was in practice and I was writing and I was doing this and I had 4 young children and all this, then people will say, how do you do? And I said, I have to do it. It was for my own, it's like I'm driven to do it. I don't feel good if I'm not challenging myself, if I'm not doing certain things. But, I know, Jess, you had experiences throughout your life where, you really had to kind of get into a zone and push yourself because you had a full plate. And, how did you kind of, navigate that in your life?
Yeah, I've always enjoyed being busy. So and
Yeah.
Steve's gonna laugh. So
I was
I
gonna say, I know someone who you're exactly describing right now.
Right.
and
Yeah.
it's come from, I just think, the discipline that I've had as growing up being a swimmer. So I chose swimming as my sport at a super young age. I think I kind of dropped off all their sports by 8 years old and really decided to focus on swimming. And it was constant. I went to school, I went to practice, I ate dinner, I went to sleep, repeat. I did homework somewhere in between. So having to be organized was always just very at the forefront, having to figure out when I was going to get my work done. um it had to be, and there was not a lot of hand holding either from my parents. They kind of said,
Mm.
okay, like this is what you're going to do and you have to figure it out. And especially with swimming too, we're notorious for being a sport that you're up at 5:30 in the
Yeah.
morning. You're doing two a days from a pretty young age. And, I would go to school with my hair wet. Everybody would always be asking me why my hair was wet and I'm smelling like chlorine. And then I'd, be getting in the pool after school as well. And then the same followed through college. And I always found that being busy actually helped me to manage my schedule. It always kept me on a timeline. It kept me accountable for the things that I had to do. So I've always found that full plate was actually
Mm.
more of a motivation to get things done. But I also understand that not everybody is the same that way. We'll have to take on what we're capable of, and taking on too much, of course, leads to burnout. So finding that
Hmm.
balance is really important, and knowing what you're capable of, and also recognizing if it is too much, you say yes, and then you realize that it is too much, that you can also take things away from your plate too. If you feel like you're not capable of doing it anymore, you're not giving all of that you can to each thing, because then it's not fair either to whatever it is you're giving into, if you're not giving your 100% to all of it as well. So just knowing yourself is a super important piece.
Yeah. Yeah. That's key. Now, how did you start with CrossFit? When did you start working out like that? Doing those kind of workouts?
Kind of begrudgingly at first. So
Yeah.
when I was at Northeastern University, we had an introduction actually to CrossFit as part of our cross training. So our assistant coach at the time was really into CrossFit. She had been introduced to it and she thought, what a cool way for our swimmers to have some type of different cross, because we already would do a lot of different types of alternate cardio. We would spin, we would run, and then we also had weight. And she was seeing the benefits for herself. She was a former swimmer, also a very accomplished swimmer herself. She was like, this is keeping me in great shape. So she had hooked it up with a gym up in Massachusetts that she went to. They would
Mm.
drive us out every Saturday to go to the gym. So to be fair, I did not have a great experience there. One of the first times we were there, they had us doing tire flips, and one of my
Oh, wow.
teammates accidentally flipped a tire on my back,
Oh,
and I went
God.
down. And that was kind of it for me. I was very sour on it.
CrossFit's fault.
But
Right.
Steve and I were together at the time, and he was very I know. The blame got misplaced, of course. I was
Right.
like, what is this? What are you making me do? And I would watch Steve, visit him when he was at school, and I was I was watching him compete at such a high level already. So it just didn't feel like it was an attainable thing to me. So
Yeah.
even when I was done swimming, I stuck with spinning because I really enjoyed that. It was something I already knew. I had already decided, like, I need somebody to tell me what to do when it comes to exercise. I've just
Mm.
been so trained to have somebody else just passing down the workouts, and I just don't want to think about it. So it really wasn't until Steve and I moved in together 5 years ago that I joined CrossFit Mawa, and that's when it just became very much a part of my life. That was kind of the consistency that I found in the sport, and now I'm a huge proponent of it as well. I find it makes me feel super healthy. I'm in the gym 5 days a week. It's helped allow me to feel super strong, work towards goals that I never thought I could continue to work on, even beyond a Division I athlete. So the identity that gets wrapped up in being an athlete and then to walk away from that can be really hard. So I feel like I've found myself again, even though I'm not competing, just to be able to work towards skills and continue to work on my brain and my body in that way feels really great on a day-to-day basis. And then it also has allowed me to do other things like run marathons. I've had a nice healthy balance with it, and keeping that weight training has been really beneficial that CrossFit allows for. So
Yeah, no, that's great. Yeah, well, the thing that
we have a lot going on outside our.
yes, here too. Yeah, it's really good. I hear it going down. It's probably going to be hailing in a few minutes. But yeah, it's
Uh,
with the my experience with CrossFit, and you really have to have a great coach because it could be dangerous, really. I mean, if you don't know what you're doing, and I hurt myself a couple times and realize now in retrospect why I hurt myself. It wasn't the coach's fault because now it was actually a blessing. It was really, kind of my ego getting involved. All right. And once that the injury I had was to my elbow, and I developed like a tennis elbow kind of thing, which was becoming kind of chronic. But what that did was it realized that I had to strengthen other areas of my body that now I've really worked on that have allowed me to really grow and feel stronger and more fit. So people shouldn't really get, they need a good coach. You really have to, can't jump right in like when you jumped right into and did the tire flips. That for somebody who's never done that kind of thing before, it's technical, but it's not technical because these are functional exercises. These are things we do in our everyday life. I mean, when I'm walking my dog, right, I'm thinking about a deadlift when I'm bending down to pick up the poop, whatever. I'm kind of doing a deadlift in a way. It's not that heavy, obviously, but it's the
Depends on
same.
what lunch was for the dog,
Right, that's true, right? It definitely is what we do in our life. And you mentioned another component which I love, and I want to talk more about this because as I get older, I'm I'm about the same age as Steve's mom, who works out in our gym, and where the most important thing I talked about fitness, but the other thing is the plasticity of our brain is you want to feed into that. And by that, it means that our cells can rejuvenate, they can make different connections. And the only way it does that is if you challenge yourself by new things, by doing new things. A lot of people, as we get older, we kind of fall back into the things that we're comfortable with that we did. So like you were saying, Steve, lying on the beach, that's kind of our idea of making it, right? My idea of making it is having time to work out, to learn a new language, to do a podcast, I mean, to have that flexibility. But it's so important to have the kind of what's the word, Steve? What's it, when you work different muscle groups, what muscle confusion?
Antagonist?
Was it?
Like antagonists, like
Antagonists or muscle confusion or whatever, and that
yeah.
that builds up, I guess, something like. But it's the same thing with the brain and brain cells, kind of mixing it up. So learning new skills, and like my thing right now, and I'm going to tackle double unders eventually, okay? But my new thing now is doing kipping pull-ups. And so Denise, our coach, and I've been doing CrossFit now for about 5 years, and I never could do a kipping pull-up, but now I'm starting to be able to do that.
I saw you working on them today.
Right, right.
Before class, I saw it. Yep.
Yeah, right. My witness. So, that is something that is learning. I'm learning new things all the time. Learning, you think you got it, but you don't. And so, I'm sure that I want to, kind of physical fitness is so great for mental health. And I mean, it's just working out and exercise is so important for mental health. And, there are obviously times when you need medication, but how does, that piece, Steve, when you're counseling people, how do you kind of do the whole thing, all in? I mean, how do you approach that?
Such a good question.
Yeah.
I mean, there's a lot that you said before that I also think is, some things that are worth going over and reiterating there. Um, you know, I think that, ultimately when it comes to approaching someone who's, coming in and they're coming through with some difficulties, some depression, some anxiety, the research is in. Exercise is just as good, if not better, than antidepressants, SSRIs. Like it's there. The evidence
Absolutely.
is very, very clear,
Yeah.
right? And to that point as well, with what you were saying before about being mindful of injuries and whatnot, um, as far as CrossFit goes, it has shown that actually the rates of injury in CrossFit are lower than those of youth sports. So
Wow.
there are not many people that are saying like, no, I'm not putting my kid in basketball and baseball and soccer. Maybe there are some people saying I'm not putting my kid in football, but
Yeah.
that's a different story.
Yeah.
Um, but regardless, like the rates are lower. And there's another important distinction, I think, as far as CrossFit goes that, really needs addressing because I think there's this belief that CrossFit is, what I did. It's, the CrossFit Games
Right. Right.
finals, right? And
Yeah.
like as we know, like the people that go to the CrossFit Games are the top 40 fittest athletes on the planet, male and female.
Yeah.
And then, you
Amazing.
go to the semifinals, it's the top, 250 fittest males and females on the planet. And you keep going back and back and back. And you wouldn't say that football is the NFL, right? Like
Right.
most people that are playing football are not in the NFL. So they actually aren't the same thing. They look very similar because, you'll have people doing similar movements, but the weights are different.
Mm.
The complexity of the movements are different. There's so many different layers to it. And I think if people got in there and recognized, as you were saying before, Charlie, just if there's a CrossFit gym somewhere, you should go check it out.
Yeah.
What they will recognize is that they scale everything down to your level, especially with a good coach. They'll be mindful of what that is. And you can advocate for yourself too, of like what you are and are not ready for, right? With
Yeah.
the caveat of, I always believe someone should kind of test their limits and push themselves a little bit. But, be your own governor and be aware of what you think, is an appropriate time to advance to that next level, like you are with kipping pull-ups right now.
Yeah. Yeah.
It's time for you to try that out. Um, but getting back to what, you were asking before about how to integrate that, right?
Yeah.
Exercise is really as good as SSRIs or antidepressants
Hmm.
as far as what's going to be helpful for your mental health. And, ultimately, you can give all that education to a patient, right? And I think for some people, that's enough. To hear it from a mental health practitioner, that's enough to get them to try something.
Yeah.
For some people, it's not. For some people, like they want to find that thing, right? But really laying the groundwork. I'm a big believer in informed consent for my patients that I work
Hmm.
with. And that's because I think if you could just say, hey, this is what we're doing here, this is what you can expect. You're going to be taking some risks emotionally and going through all that and putting it on them and giving them, the responsibility. I also try to empower them of like, hey, you can do these things too. Like you can feel like it's, you're a bad person for admitting that you did something wrong, but you'll realize that that's actually a very common human experience to,
Hmm.
to do negative things. Good people can do negative things, right? And just by normalizing that process a little bit more, I think you get a little bit more of a buy-in. And then once you have that buy-in, I think you have a little bit more wiggle room to work with someone kind of show them what healthy habits they can do. Find one change, right? I know health can be very overwhelming for a lot of people. Like,
Yeah.
get in the cold plunge, get in the sauna, make sure that you're getting enough vitamin D, get outside, socialize. Right? There's a million, eat,
Yeah.
like don't eat too late, make sure you're hydrating. There's so many different things that you can touch on. It gets overwhelming. I think validating and normalizing that for someone and then finding the one thing that they can implement over time, I think that's really a great way to kind of encourage some positive momentum towards exercise, towards nutrition, towards whatever it is that someone might need when you do that assessment of seeing, kind of where people are lacking in their life. So that's really the way that I like to try and incorporate
Yeah,
a lot of.
that's a great strategy. I was talking with a friend who he works for the Fellowship of Christian Athletes, which is about 70 different schools, I think. And he went to a seminar, and the seminar they invited. He didn't know the guy's name, but he's apparently a very well-known speaker in health and wellness. And he said that, just like you were saying, he said this is what you should be doing, and he listed, you should be working out 75 minutes in the morning, and then 75 minutes in the evening, right?
Mhm.
And then you should be doing the cold plunge in the morning, then the spa in the evening. Then you should be. He listed all these things that there's no way. First of all, someone has the time or the money.
Not realistic. Yeah.
No, totally unrealistic. So
Yeah.
it's about implementing consistency. And I'm sure, Jess, you see that with, the your clientele will come in, and the parents who are supposed to set good examples for their children. But I know you're working with Steve also in this sports performance area. And so you're dealing with adults also besides children, Jess?
Yeah, I work with some adults, probably up until about the age of 40. I have some adults on my caseload as well.
Okay. Yeah. So
So I
you're
see them.
seeing, yes. What are some of the things that you're kind of seeing, and how you implement, that mindset?
So it looks a little bit different based off of ages, but a lot of times the pressure is coming from the parents for all of these things to be getting done. And then the kids become so overwhelmed that they can't do it. So then they kind of give up
Mm,
on doing any of it, because it's like, if I can't do all of this, then it's a very all or nothing thinking that we can easily fall into the trap of, but also more developmentally appropriate too for that all or nothing thinking to exist for kids.
yeah.
So with them, it takes a lot of parent work to set expectations and work with the parents on understanding what it is that the child's goal is. What is it that they want to get out of whatever it is that they're doing, whether it be their sport, school, extracurriculars, really understanding what's important to them and their values, and seeing how the parents can then support them without adding pressure or giving their opinions too much. Of course, there's encouragement that's important, but sometimes the encouragement can go really too far into pushing, and we don't get the best outcomes that way. So it's really finding the best balance for them and working on both sides. And
Yeah.
then,
Go ahead.
yeah,
Sorry. Yeah.
was gonna say, and then for adults, it's just same thing, kind of doing a values assessment for them as well, seeing what's important to them, what's the most important to maybe the least important, especially if we're feeling stressed. Is there anything we can take off the plate? And then also, identifying, this one step at a time. I always tell my patients we have to look at it like it's a plate of food. And if I were to ask you to eat all of this in one bite, how overwhelming would that feel? It's not possible. You probably wouldn't even try. But if I told you that you could do it in 30 bites, how much more manageable does that feel? So we always have to break it down and make smaller goals and then work our way towards what's the most important to us.
Well, as you're talking, it hit me. Okay.
Mm.
I mean, it's really the same thing, because we're adults, but this automatic brain, I call it, is developed from birth to adolescence. So our habits really are our child's brain. And I mean, we could fix that with our choices and the way we do things, but really it's the same approach when you're dealing with children and adults, because we're really children in adult bodies. So um I love to use this parable that, or the story, and I've told it before on other podcasts, but I think it's worth repeating because it really speaks to this. And when I was in my 20s, karate was my thing, and I did karate and I always wanted to do karate. It was like I looked at kids growing up, and I was kind of envious of them, and I always had it in my head that I wanted to do it. So I went to medical school, and there happened to be a karate club in my medical school, which I joined, and I stuck with it. It was really my social life, my workout life. It was great. It really got me through medical school and residency. And there was Joe Hyams, who wrote a book called Zen and the Martial Arts, and he tells this story about this 10-year-old boy who goes to the sensei, and he says, "Sensei, I want to be a black belt. How many years is it going to take?" And the sensei says, 10 years. In the sense that the little boy says, 10 years, I'm 10 years old. That's my whole life. But what if I put all my effort into it, and it's all I do and think about is karate? How long then, sensei? Sensei says 20 years. 20 years. He's dumbfounded. He says, what if I come here and live in the dojo, and I dedicate my entire life to learning from you, and eating, sleeping, drinking, everything I do is karate. How long then, sensei? Sensei says 30 years. And so the boy just gives up and looks dumbfounded, and says, "Sensei, please explain. I don't understand." And the sensei looks at him and he says, "If you have one eye on your goal, you only have one eye on the path in which to find the way." So what happens is we get so overwhelmed. The goal is so big and is so ominous, it sometimes paralyzes us and we don't do it. That's why I love what you're talking about, both of you, is how you take that one step at a time and you focus on those individual steps, and it doesn't seem so overwhelming. And and Steve, you were talking about the SSRIs and physical fitness. Think about it, and getting back to this child's brain, we want a quick fix, right? That's why it's so easy. Patient comes to the doctor, "Doc, I'm depressed, I'm anxious. Okay, take this pill. I'll see you later. Come back in a month or whatever, and we'll re-up it, and we'll see what's happening." It's like the whole thing with the weight loss meds now, the Wegovy, the Mounjaro, and on all these medications that is a quick fix. Do you guys see people coming in on these meds now? I'm just curious, like, not the SSRIs, but I know you have a lot, people, I'm sure, but these weight loss medications, have people asked you about them?
I've gotten questions, but I can't say for sure if I know if anyone's actually actively taking them.
Okay.
And I don't know if that's a little bit of like they know my perspective on that.
Right, right,
So they're just like, I'm not even going to bother having this conversation.
right, right.
Um, so I'm not too sure about that, but I do want to comment on what you were saying about that
Yeah,
mindset of looking for that quick fix. And
yeah,
also, like, even if you are totally committed and willing to put in the hard work and have your one eye on the goal, like that beautiful example that you just gave, ultimately that mentality is an all consumed mentality. And I like to really talk a lot about an all consumed versus all in mentality,
mm,
particularly with athletes. And an all consumed mentality is just that. It's that everything that I'm working towards is towards what my goal is. And there are some outliers out there where that actually worked. Look
yeah,
at Michael
yeah,
Jordan, look at
yes, yeah,
Tiger Woods. Like, but if you think about it, there's only one Michael Jordan. There's
yeah,
only one Tiger Woods. They're outliers for a reason.
yeah,
Generally speaking, what happens to people when they take an all consumed mentality is that becomes their identity.
mm,
And if something becomes your identity, what happens when you come across failure? What happens when you come across struggle? What happens when you come across just obstacles and bumps in the road? It takes a shot at your ego completely. And,
mm,
if you're a baseball player, for example, who strikes out, well, I'm a baseball player and I'm striking out, so I can't even be good at that, so I can't even be good at anything, right?
Yeah. Wow.
Shot at your self-esteem. It's a huge shot at just, you being willing to continue on and play. Whereas someone who's all in is going to take all of those steps and do all of the things that they need to do as far as practice goes, as far as taking care of themselves. But they strike out, they're going to realize I still got a loving family. I still have, my academics. I still have my faith. I still have so many different things that they can
Mm,
fall back on, and they're going to continue to endure and they're going to continue to compete, right? So
yeah.
ultimately, it's something that I talk about, and Jess talks a lot about with the athletes that we're working with now, is that identity of being more than just the athlete, and how kind of in a backwards way that helps them to get better at their sport, because there's going to be some consistency and longevity in it versus that intense star that just burns out and dies out the first sign of struggle.
Yeah. Oh, those are great examples. And I think about, I can't remember his name now. I knew it a few weeks ago, but the young guy who committed suicide on the PGA Tour, so tragic. And he had just won in Hawaii, but then he was at the Charles Schwab Classic, and he made the cut, but it wasn't doing quite. It's so much he had that mentality, that all-consuming mentality, and that's what he defined himself. And suicide is the ultimate flight. It's the ultimate escape from danger. Life is more dangerous than the alternative. And in their thinking, and not succeeding was such a devastating thing for him. Roger Federer, I just heard a clip on his speech at Dartmouth College graduation, and he was saying how um, that he won 80% of the tournaments that he was in. And so he said, well, you probably think, wow, that's pretty good. He goes, how many points do you think I won? And he said, I think he said like 52%, just over half. Okay. So just think of all the points he lost, but he still came out ahead. But if he said, just you focus from one point to the next. And this is not saying that you can't have a goal. Okay. We all have a goal in mind, but it's all consuming nature of it that can really paralyze you and keep you stuck. So, I think I think it might be good to talk about some of the things that we do to kind of keep us going. I mean, I know that I remember through my 20s in karate, there was at least half the time I was so tired from work, studying and residency. Half the time I didn't go, but I pushed myself to go. And I, if I didn't push I would have given up, And so I know Jess, like you ran the marathon, and just in your swimming, there must have been so many times that you had to push yourself. And what are some of the tools that you kind of drew from deep down that motivated you to
Mm-hmm.
to kind of keep going or to go further?
Mm-hmm. Looked different for everything that I was doing, but definitely with the Boston Marathon that I just ran on April 15th of this year, I got a last minute bib. So I got it on January 31st. That's when I found out I was running. So I had 11 weeks to train.
Wow.
And I had done, Steve and I did a marathon in Fort Worth a couple of years ago, and the training just felt so different. I mean, I think it was helpful that I had already had a marathon under my legs to kind of know what to expect.
Yeah.
But just in terms of the training, I kind of put my head down and said, I just had to accept it in that moment. I'm either going to do this or I'm not going to. And if I say I'm going to do it, then I have to put everything into it. So when I picked out my training plan, I picked out a 12-week training plan and just squeezed it into the 11 weeks that I had, and just got up every morning, worked around my work schedule and our schedule in terms of our social schedule of things that we had already had plans for the next few months coming up, and just kind of had to figure it out. And every time that I ran, I kept thinking about the reason that I was running.
Mm.
I always had that in the forefront for my mind, and that was really helpful to give me a little bit of a runner's high and really would push me forward on all of my long runs and everything that I was doing on my own. So always thinking about the goal that was at the end, even when those runs could feel really hard. Maybe it was really cold because I was, it was running in January, February, with some rough weather, some icy days, snow and things like that. So every time that it was kind of feeling a little bit like, oh my goodness, I have to go out there and do this, I quickly would move that thought out of my head and think about what was to be on the other side. And that would get me really excited.
Yeah.
Um, the same with swimming. I mean, swimming was always kind of moving the marker of what my goals were as I got older. So it would always be whatever the swim meet was to get me to the next step that I wanted to be. So when I was younger, it was a big thing to be a national swimmer on our team, to be on the national team. So it would be, well, every time I get in the pool, it's just another step towards me making the national team. And if I had already made the national team, then it's another step towards me making the national team with another event that I can swim and have the choice of swimming when I go. And then beyond that, after I made nationals, it was okay, I want to be a collegiate athlete. So this is another step for me to make it to college. And then when I was in college, it was okay, I want to make sure that my goal was every year to be on our conference team. And so it was like, okay, every time I get in the pool or whatever I'm doing is another step towards being able to make it towards the conference team this year.
Yeah. Yeah. So, I mean, so there, that story I told doesn't mean you don't have a goal,
Hmm.
right? Because, yeah, it is good to have a goal. And sometimes it's better to have those short-term goals because those
Hmm.
short-term goals eventually lead to that long-term goal. And I know for me, uh, as a doctor, seeing patients who were getting older and sick, that was one of the motivations behind me staying healthy because I didn't want to end up like that. And we had a saying in karate actually years ago that the greatest, it's kind of dark, but the greatest pleasure in life is the relief of pain, right? And so, but in a sense, if you look at this primitive brain of ours, this animal nature, and how we fight and flee danger, it really is pain is danger. And some of the things that motivate me is kind of making the if I'm in a habit that I don't like, I want to make it, and that's my comfort zone. I want to make my comfort zone, I want to make a new comfort zone. So making the uncomfortable comforting, or the unfamiliar familiar. And so that kind of sabotages your animal brain, or it derails it. So you're not fighting and fleeing the thing that you want to do to make you run that marathon, or or not even, or to take that one step to do some fitness, or one thing you were saying it, Steve, earlier about how you, when you uh, um, consult or advise patients that, or clients, that you tell them, help them just choose one thing and kind of zone in on that one thing. And I think that's great advice that
Hey,
you're giving.
Charlie,
Yeah.
I actually just kind of thought of something
Yeah.
as you were talking about that, about the pleasure and pain. Can we talk about social media for a second?
Yeah. Oh, let's do it. Yeah,
Because
absolutely.
I
Yeah.
feel like that just immediately triggered in my head for a second. Like that, I feel like in a lot of ways, social media is that thing, or the phone is that thing, or technology is that thing that helps to avoid that pain too, right?
Yeah, absolutely. Yeah.
So in a way, like in so many different avenues now, we do live in a society where you can get away from pain very easily, right? Anything that
Hmm.
is now discomforting in some level, well, there's an antidote to that, right? Like if I'm
Mm.
socially anxious, I can hop on my phone and I can still fulfill, entertainment and numb out and just kind of detach my brain and disengage my brain completely. And then, that will be something that will kind of just, be like a pacifier, so to speak, for a little.
Yeah.
Um, Jess and I working with adolescents, I feel like it's something that's a lot more glaring that we see in terms of the levels of anxiety that
Mm,
our clients really have when it comes to communicating with others, especially face to face, doing things as seemingly simple as a phone call.
mm,
A takeout place that you want to order something all of a sudden becomes this big endeavor because it's someone that I don't know, and I'm used to kind of just pressing a button and
mm.
get my food, right? So now I feel like so often it's almost hard to find a way to bulletproof yourself, so to speak, by doing the maybe slightly more challenging thing, the slightly discomforting thing. But ironically, that's the thing that helps people kind of deal with stress better in their life, is finding that discomfort and not seeking
Yeah.
that
Yeah.
that is so easily accessible for us now.
Yeah. Oh, that's great points. And really, it's with the ubiquitous nature of the social media and our phones, and it's so at our fingertips. It really cycles people within that automatic brain that I call it, that primitive nature, the pain and pleasure. And instead of tapping into that higher consciousness, the part of us that can really move us into a direction of a really satisfying life, and neuro chemical, the hormonally, and the surges of different neurotransmitters that cause different pain and pleasure sensations that are continually firing when we try to pacify ourselves, like you're saying. And it's really and I'm thinking about it lately, um seeing kids when they're getting off the bus from school, or driving past the school, and seeing, and I kind of I feel sorry and sad because I'm so happy I didn't have that when I was a kid. Growing up was hard enough,
Yeah.
but now
Yeah.
you have this, you
Yeah.
know,
Yeah.
and yeah, I mean that's like, how are you kind of like, what can parents do, okay, to help their children? So, I mean, I know some of the things that we did with when our kids were young, but still, I don't think we did enough. But the people, and how does that in your practice, both Jess and Steve, as far as kids coming in and being affected by the social media and kind of being stuck in this, I kind of look at the anxiety as the fight or flight being ramped up, and the depression as being the flight part of that ramped up, but it's still part of the same, kind of uh, push and pull that they're having mentally. Like, what are you doing with that? What do you do with that? And how can
Yeah.
parents help with that?
Well, for one, as you were saying, like seeing kids on their phone and being like, "Oh, childhood was hard enough as it is, and now you have this." Jess and I will comment if we're kind of let's say we walk by a restaurant or something like that, and we see two people out to dinner
Oh
together,
yeah. Oh man.
and they're just looking at their phones, like
Yeah.
right across from each other. Um, so it's more than just children, right?
Yeah.
Like it's
Yeah.
definitely permeated into adults, and the reason is because it's made to keep you on it. Like these
Yes.
technologies made to keep you on it so that they can collect the data from you as much as possible, so things can be marketable, and all of that. So number one, as a parent, like it's a bear of a project to be able to overcome, because we're fighting against something that's it's insurmountable in a lot of ways.
Yeah.
So I'll let Jess kind of talk a little bit more about different strategies that you can use to be able to overcome that and help people with it. As far as parenting goes, the one thing that I always fall back on is, I think, modeling, right? Like if if you're hoping that your kid themselves is able to be functioning and not be attached and addicted, if you will, to the cell phone, then you yourself cannot be
Mm.
resembling that behavior. You have to be aware of your screen time, how you're using your phone. I mean, don't get me wrong, cell phone cell phones are insane, tremendous technology
Oh
that's
yeah. Oh, absolutely. Yeah.
wildly connecting and
Yeah.
extremely helpful in terms of finding support for things that previously were very challenging to find. And it's a blessing in so many ways, but
Yeah.
it also is, it's kind of like that double-edged sword there where you have to be mindful of like, hey, also is this getting in the way of my relationships, of my own mental health? Because now this is what I go to. That it reigns supreme over everything else, just like any other addiction in our life. So I think really just modeling what's appropriate with cell phones
Yeah.
is a big one. I hope
Key.
I
Love
answered
that.
it. I
Yeah.
hope I did a good one, Jess. But I know.
Mhm.
Yeah.
Yeah, I've told parents too, in terms of that modeling, because when I have had conversations with kids about them being on their devices and what it looks like in terms of the breakdown of their day of how much they're on it versus what they're doing with the rest of their time. If ever I do have a parent who comes in and says, I need them to be off, I hear it all the time. They need to be off their screen. They need to be off their screen. I always ask, well, what are you doing in terms of your screen? And kids are so quick to throw their parents under the bus. She's on her phone, he's on his phone, they're on their computers, whatever it might be.
Yeah.
And, I said, or I'll say a lot that kind of, I understand that with COVID and then just beyond the attachment that adults even have to their phones outside of social media, we're attached to it for work. You have the accessibility to answer work emails at any given hour.
Mm-hmm.
And people's works also might expect that they're still responding beyond that 9 to 5 hour. And I've asked parents, if you can set the example, because then they'll always come back with, I'm working, I'm working. So
Mm.
I've always said, like, if you can step away outside of the room and say, I have to catch up on some work. I know it looks like I'm on my phone, but I am responding to emails or I'm doing something work related. I'm going to walk out of the room for 10 minutes. I'm going to come back. I'm going to put my phone down and you'll have my undivided attention. Because when parents are on their devices, that's when kids' behaviors ramp up. So even the example that Steve was giving, what we saw, what we were observing, and this is not a task. We could talk about it all day long, but we also
Yeah.
talk about the fear we have for when we become parents, because there is no one size fits all. There's
Right.
no
Right.
perfect answer, but there are things that
Absolutely.
we can
I'll
definitely
vouch for that.
try.
Mhm. Yeah.
But what we observed recently, we were out to dinner, and as we were leaving, there was this couple that was sitting across from each other, both had their phones, and they had probably like a 2 or 3 year old child who just was like absolutely vying for their attention,
Mm.
pulling on mom, trying to climb on the table. So this is when we get a really big increase in negative behaviors, which then ultimately will lead the parent to yelling or doing something in terms of trying to crack down on the behavior, and then it's causing a rift between that relationship, but in the
Yeah.
reality, the parents started it.
Right.
Um, so this is something that I talk really about a lot with parents too, is, how are you approaching your own devices? And then how are you also setting boundaries with it? Because I'm always getting asked my opinion. I'm sure Steve is too, about like, how much time is a perfect amount of time. There is no perfect amount of time. Some kids really enjoy it. Some kids can kind of take it or leave it in terms of the
Mm.
devices that they have or they want to use. But there is a beautiful thing called screen time, and you can set it and you can have parental controls. You can say, I want my kid to be on for 1 or 2 hours a day, and that's it. When that thing turns off, that thing turns off. And you're
Yeah.
setting really strict limits around it, that you're also following through, that if you say that that's the case, that you're also going to do it.
Yeah.
So there's a lot that comes into play, and we don't want to take it away from kids entirely, because it is connecting socially. Sometimes that's
Hmm.
how their friends are playing after school, and we want
Yeah.
them to have that. We also want them to understand technology and where it's going. They shouldn't be shunned from it either. To not wanting them to have to play catch up wouldn't be a fun thing either, if that's something that is desirable to them or that's where society is kind of heading. But it is striking a balance, because I have a kid who says it beautifully. Sometimes he tells me he needs to go outside and touch grass, and I love it. I'm like, yes,
Mm.
please go do that.
Yeah. Uh, yeah. It's but I mean, you can't get on the parents' case just. I mean, they have to. I mean, they have to see how many likes on their TikTok video. I mean, that's
I
very
know.
important.
It is
Come
very,
on. You
it's
gotta,
very
you
important.
got. But with
Oh,
parenting, one of the things that look, even you can come from the perfect home. All right, quote perfect. There's not perfect parents, right? Our brain is assembling information from birth to adolescence. It's a child's brain. So even if the perfect home, you're going to make associations that are nuts and that are crazy, that are not connected with logic, that are going to follow us throughout our lifetime, even with the perfect parenting. But you know, the difference between somebody who has severe mental illness and somebody who has garden variety challenges in life and emotional anxiety, whatever, is the degree of what those things that happen during the childhood. Um, but wait, there was something I was going to say that kind of I lost. I kind of went on. Oh yes, I know. You know, I think a key in parenting is understanding the difference between being aggressive, being passive, and being assertive, right? So what you're talking about, Jess, is being assertive, is setting those limits. The aggressive parent will hit, right, and or yell. The and so it's a I win, you lose scenario. Okay. The passive parent is going to say, oh, no consequences for bad behavior. So it's kind of I lose, you win scenario. But the assertive parent will set those boundaries and will be, this is what the consequences. When you do this, this is what happens. And keeping that, and that's really becomes a win-win. Even though it might seem at the time for the child that it's a loss, it really isn't, because you're establishing those boundaries and you're carrying through with those boundaries. So, I think that that's something that I tried to keep as a parent in mind, that, you have to be strong, but in an assertive way rather than an aggressive or passive way. Certainly not passive aggressive way. That's a whole other story.
That brings plenty of problems going that way too,
Yeah.
passively.
Yeah. But, I love having you guys on and, just talking about this, how important it is just holistically to have a fulfilling, satisfying, fully healthy life. It really demands a balance of lifestyle choices and also emotional stability. And I love that you guys are working together and in the same center, the Lucan Center, and how how you realize how important that all of this is for healthy aging. And that's one thing that as I am aging, right in front of the mirror, I can't believe how old I am.
Let's
But
do.
yeah, exactly. Everybody is,
Everybody, yeah.
and I want to be good role models for my children and for younger people. And it's certainly something that we want to avoid being in the doctor's office. It's trying to remain healthy, sometimes despite our doctor's recommendations. And so, I really thank you, for coming on the CoachMD podcast. And I'm going to say, as I always do, to my listeners and viewers, that thanks for believing in me and trusting my guests and what we have to say, and certainly would love to hear your feedback. And until next time, I'm Dr. Charles Glassman, urging you to stay strong in mind, in body, and especially right here in soul. Bye for now.